Oral pill, step 1. Check each medication record to see who is scheduled to receive medications on
The first thing that we want to do when we're passing medications during the course of our day is we want to go over our medications in respect to what medications we're going to be giving at what time. And when we want to bring some order to that. So what we want to do is we're going to look at our medications, we're going to put them in order of time, who we're giving our meds to, and then of course we're going to be looking at giving medications from the easiest med to the hardest med, cleanest medication to the dirtiest medication, starting with oral medications first.
Step 2. Check drug cards, reference books, or licensed healthcare provider for the desired effects, side effects, adverse effects, and contraindications of each medication. Check related information for instructions on storing, preparing, and giving the medication.
And then we want to check out every medication that we're giving. We should always know about medications that we give and what they do to the individual that's going to be taking them. We need to review the therapeutic effect, side effects, adverse effects, review contraindications, and related information. We're going to check that information against the individual's allergies to make sure that the medication is safe to give. We want to wash our work area and wash our hands. We want to make sure that our environment is organized, that it's clean. Then we're going to begin.
Step 5. Before removing the medication bottle from storage, do check number 1 of the 3 checks of the 5 rights, comparing the pharmacy label to the medication.
First thing we want to do is we want to unlock our cabinet, find our medication, and before we take the medication out of our storage unit, we're going to do our first check. We're going to check first by checking the name of the individual from the pharmacy label to the med record. We're going to check the medications from the pharmacy label to the med record. We're going to look at the dose of the medication. Then we'll be checking the route and the time that we're giving the medication. That is our first check. We always check from the pharmacy label to the medication record. We read it thoroughly, precisely, and reading it in steps by breaking up that information allows us to find any errors in the transcription of that information from the pharmacy label to the medication record.
Step 6. Take the bottle from storage and immediately do check number 2 of the 3 checks of the 5 rights as you did.
After we've done that first check, we're going to take the medication out of the storage unit and immediately do the second check of the 5 rights. We're going to check first by checking the name of the individual from the pharmacy label to the med record. We're going to check the medications from the pharmacy label to the med record. We're going to look at the dose of the medication. Then we'll be checking the route and the time that we're giving the medication. We always check from the pharmacy label to the medication record.
Step 7. Remove a cup from the supply area.
At this time, we want to take a medication cup from our supplies.
Step 8. Pour the correct number of pills, capsules, or tablets into the lid of the bottle. From the lid, pour the medication into the cup.
And then we want to open up the medication bottle. We're going to take the top off that medication bottle, and we're going to dispense the medication into the cap of our medication bottle. Then I can transfer it into the medication cup. At that time, I can put the cup on my tray, put the cap back on the bottle, and at this time, I'm going to do my third check.
Step 9. Do check number 3 of the 3 checks of the 5 rights. Do I have the right medication for the right person at the right time, and did I put the right dosage?
So when I do my third check, we're going to check first by checking the name of the individual from the pharmacy label to the med record. We're going to check the medications from the pharmacy label to the med record. We're going to look at the dose of the medication. Then we'll be checking the route and the time that we're giving the medication. We always check from the pharmacy label to the medication record, assuring that I have the right medication for the right individual.
Step 10. Put the medication container back in the internal
and put that medication away in the locked storage unit. At this time, I'm going to get something in which the individual prefers to drink in order to help them take that medication. And then, because I don't know who the individual
Step
is that
11.
I am giving the medications on, I want to make sure that I appropriately identify the individual I'm giving medications to. In this case, I'm going to go to a senior staff person, someone who has a relationship with the individual that they've known for a long time, and I'm going to ask that individual, the staff person, to assist me in helping me identify the individual that I'm passing the medications to. Once I've done that and I know who it is that I'm passing the medications to, I'm going to introduce myself, let them know who I am, what my role is in the workplace, and this also assists us in creating a relationship with this individual while we give those medications. I'm going to explain to the individual what these medications are, why I'm giving them, and from there, I'm going to ask the individual to take those medications. I'm going to hand the medication cup with the pill to the individual, offer them something to drink. Once they have taken that medication, I'm going to ask them some open-ended questions, questions in which they can speak to me and talk with me
14.
in a full sentence so that I can determine whether or not that individual has taken their medications. Also, I'm maintaining a relationship with that individual, and I'm creating a relationship that is a relationship in which they feel safe during that period of time.
Step 15. Dispose of the cup in the proper wastebasket away from the person taking the medicine and wash
At that
your
time,
hands thoroughly.
I'm going to excuse myself, let them know that I'll be back to see them and check on them in just a few minutes. And then I'm going to take all of my garbage, my medication cup, anything that I have that I use during that period of time, back to my medication area where I began this process and throw all of my garbage away after I've thrown away my garbage in the appropriate receptacles away from the individual in which we're working with. I'm going to wash my hands and immediately go to my medication sheet, and I'm going to document and take credit for the fact that those medications have just been dispensed.